From the perspective of the American Animal Hospital Association, the reason that we sought to go down the road of veterinary network accreditation is because it's clear that consolidation of privately owned veterinary hospitals is going to continue. And we know that there are always going to be a group of privately owned practices that will be AAHA accredited and will be great places to take your pets. And we know that there are going to be lots of great places to take your pets that are owned by various corporate entities. So the idea of AAHA offering the opportunity for a veterinary network to become accredited really made total sense to us. I'm happy to welcome today David Mervin, one of the co-founders of PetWell Partners. PetWell is our very first company to achieve AAHA Veterinary Network accreditation. So congratulations on that. Says a lot about your company. So we're really excited to talk more about that today. It's important to know that to be considered for network accreditation, at least 90% of that group's practices have to be either accredited or pre-accredited. But the actual network accreditation really doesn't focus so much on the medical part. It's more on the business practices and how they take care of their employees and how they attract and retain great employees, how they focus on their culture.
To add to that, network accreditation doesn't make sense if you aren't bought into the value of AAHA
Absolutely.
In your hospitals.
Yep.
You know, I worked for a time in higher education where accreditation plays a huge role in assessing quality and signaling to students or prospective faculty or staff the kind of institution that they might work or study at. And if you look at human health care, accreditation plays a big role.
Right.
So, in many ways, I think the veterinary profession lags others in terms of recognizing the value of accreditation. Given today's climate of consolidation, given the amount of change that we're seeing in the profession, I think now more than ever, accreditation is important. 15% of hospitals are accredited. PetWell currently is the only network to be accredited. I would love to see 10 years from now, the majority of hospitals become accredited, and many more networks like ours become network accredited.
We throw around that 15% number a fair amount. The fact that only that many hospitals are accredited, it's still very much a differentiator from the other 85% of practices who are not. And that's not to say that some of those practices aren't great, but the 15% have made the commitment to opening their doors to our scrutiny, to keeping current with the standards and everything that goes along with that. So I believe it is very much a differentiator, and we continue to work, as we have been since 1933, to help pet owners understand why that's important and that it's not a mandatory thing that practices choose to do.
For the first time, I think we have a step toward some standards of quality for these corporate groups that are entering the space.
You can tell that y'all are trying to build a legacy business that's going to be around a long time. And we can see other examples of times where people are just trying to throw together a group of practices in hopes that somebody buys them.
Sure. There's
a big difference in just the overall atmosphere, if you will, and that would speak volumes to me if I could walk away knowing that that practice is always going to be accredited.
Sure, and just knowing that your partner is aligned with the same standards that hospital owners that go through AAHA accreditation have made a huge financial and time commitment to go through that process and maintain it. Knowing that your next partner is aligned with that, I would think would be a very meaningful thing. Really, organization-wide, I think people are proud to be the first to be network accredited. They're proud of the work that went in to get there. It's a great recognition of not only what they went through during the assessment of network accreditation, but all of the little things that our team does every day, every week, every month to ensure that we're building a quality organization. So I think a lot of credit should go to Mike and Mitch and Jan and the board at AAHA for really taking hold of the vision of network accreditation, pulling together all the resources to bring it to life. And we're honored to have played a part in that development, and certainly proud to be the first to become network accredited.
We've talked about the rapidly changing profession in a rapidly changing society in a rapidly changing world, and that's a challenge. So we appreciate PetWell's interest and your ideas and encouragement for us to go down this path. Very much appreciated.